This panel will highlight the skilling in healthcare, skilling of health professionals, especially gynecologists and pediatricians, upgradation infrastructure and skilling in radiology. For this panel, we have with us Dr. Apurva Kumar Bhattacharya, Professor and HOD ONG Department, Nalbari Medical College. Can we please have Dr. Apurva Kumar Bhattacharya, Professor and HOD ONG Department, Nalbari Medical College. Can we have a round of applause for Sir, please?
We also have Dr. Rashna Das Hazarika, Senior Consultant Pediatrics and Neonatology, Guwahati. Dr. Rashna Das Hazarika. Dr. Bipul Kumar Das, Assistant Professor, Pediatrics, AIMS, Guwahati. Dr. Bipul Kumar Das. H. Adhikari, MD, Zenith Diagnostics, Bongaigaon. We request Professor B.P. Chakravarti, Medical Director, Health City Hospitals, Guwahati, to kindly come on stage and moderate the session for us. Thank you, sir.
After the pulsating bihu dances, we come more to the ground, to our big problems, because most of you must be knowing that though we have made big strides in the services of mankind in the form of medical services, we still are lagging behind the rest of India in certain aspects. One of them is this: maternal mortality rate, infant mortality rate. With this, first I would like to tell my co-panelists to talk about the problem, and then they will go into the skilling by which we can reduce these bad numbers in both maternal health and the health of the newborn and the child. So first, I will ask Dr. Apurva Bhattacharya to start.
Thank you, sir. First of all, I'd like to thank the organizers for bringing this aspect of the global meet. Actually, whenever we talk about maternal mortality, Assam is one of the places with highest maternal mortality, and which is a national indicator of health. It's an indicator for our healthcare system. So, but what we see for the last 10 years, though it is highest, if you say, it is 195 per 100,000 live births now, compared to the Indian average of 97 per 100,000 live births. Still, for the last 10 years, there are a lot of programs that are government is bringing out some skill development for skilling. There are multi-skilling programs for the MBBS doctors and nurses, even health professionals also. And we have seen some, rather we can say that it is improved a lot, if you say, especially the remote areas which are not touched previously. Now communication is better. We have got a lot of problems here, local problems. We have got during flood season, the roads are cut off. If you see the northeast region especially, but still our governments of different state governments, they are doing their best, and with the help of our central government, they are improving the infrastructure for health also. A lot of FRUs have been developed, and for the latest, if you say, we are again, our government is interested in building up almost 100 more FRUs in different districts. And we have got a lot of district hospitals. We have got public primary health centers. So it's coming down. But if you compare from 2012 to 2012 or 23, or in these 10 years, we have improved a lot. But we need to improve more. So for that, I think there are a lot of scope for skilling of our doctors, nurses, and health professionals. Thank you, sir.
What kind of skillings would you like to tell the audience that what kind of skilling programs are being taken up?
Yeah. Right from 2004, India government started with our Federation of Obstetrics and Gynecology. 2001 program was EMOC, that is Emergency Obstetric Care. It is seen that if you, even if you go for checkup regularly of a mother, and if you find everything normal, still there is 30% of complication may develop during childbirth. So that is a EMOC, and after that it was known as comprehensive EMOC program. It was a 6 weeks training in the medical colleges. There are SEP center, main center, and other, say 10 weeks in the district hospitals, which were selected by some inspectors from the different centers. There was another one was LSAS, that is a life-saving skills, anesthesia skills. That is a purely anesthetics program, because we have got some dearth of anesthesiologists and in the peripheries. So that is another program. Another program that was taken out after 2010 is after RCS program. It is a BEMOC, basic EMOC. In the peripheral centers, we train them. Rather, it is rather more of a orientation and more of a training purpose. We train some skills which are very much needed to save mothers. That is a BEMOC, basic EMOC program for the primary health centers and the remote centers. For nurses, there are skill but attendant, SBA training going on. It's still going on. BEMOC is also going on. EMOC centers, first we had the Guwahati center in 2008. We started from, then we train around 13 batches of doctors there. After that, another center developed at Dibrugarh, which is in the Upper Assam, and third center developed at Imphal. So they trained a lot of batches, and those who are working now in different FRUs and doing operations, doing deliveries, and are contributing to reduce the maternal mortality as such. And regarding skill but attendant, it is going on everywhere training, BEMOC training in medical colleges it is going on. We have got right now, we have got 9 medical colleges, another 3 are coming up, so 12 medical colleges. We have got different centers in the medical colleges, and there we have got skilled person. They have got, they are trained. That is trained personnel from medical faculties. They are training the state doctors for the health. And apart from that, we have got some orientation program, training workshops in different conferences. In 2010, right back in 2010, we had a very good conference. We trained about 200 doctors from the periphery in this different skills. Thank you.
Thank you, Dr. Bharat. And lots of medical colleges are coming up, and I think these skilling programs will be working more. So I next go to Dr. Rasna Das, who is an eminent pediatrician and neonatologist. She will be talking about neonatal health and death.
Thank you, sir, and thank you, the organizers. I know you are really wanting to listen to and see the cultural program. But I think newborn health is something which is very important in our country, and especially in Assam. We were, if you talk of 2004, we were very bad in these statistics in the sense that about 35 to 36 per 1,000 live birth babies were dying in the newborn period. But we have come a long way from 2004 to 2022, and it is one of the best performing states if you look at the health data from the government of India. In fact, in the last 1 decade, we have come down from 30 deaths of newborns per 1,000 live birth to 19 currently, and probably it'll be much better when we have the statistics coming in now. So if you look at these data, I mean, people may think, that there is nothing happening here, but there's a lot of involvement of the state government which has helped in bringing the neonatal mortality by so many points down. In fact, the government of Assam was awarded for this, and I think it's a big achievement for the state. And this actually, initially, I think we were concentrating more on the tertiary care centers for giving newborn health. But when we started concentrating on the peripheral health system and started training our ANMs and ASHA workers in newborn care, the improvement in the statistics is reflected by that. So not only the government of India program like the Navjat Sishu Suraksha Karyakram, which is also parallelly run by the highest body of pediatricians in India, that is the Indian Academy of Pediatrics. We started training from our end also to the health workers, the staff nurses, the ANMs on the basic newborn resuscitation program. And that has helped a great deal in the peripheral centers, sir, where we could prevent birth asphyxia, which is one of the most common cause of newborn death in our state and in our country as well. So I think these kind of trainings are helping, and we are now doing not theoretical training, but we do skill-based training in the sense we give them practical training. We have mannequins which are brought in and they are allowed to practice. And the beauty of the training is that we don't allow anybody to go until they have developed the skills So it takes about a whole day to do that. So we have done lots and lots of program from 2008 onwards, and it's still running strong, sir.
Thank you. These skilling trainings are very important because we cannot produce lots of MDs because of the restrictions of taking, getting admission in the medical colleges for MD. So the way she said that we must train our nurses and other paramedical staffs for more skilling so that we can save a lot of babies. Now, my next in my panel is another pediatrician, Dr. Bipul, who will be speaking about what are the causes you think here is the high rate of NMR and IMR.
Thank you, sir. Good evening, everyone. Actually, already Madam has mentioned about the problems associated with neonatal mortality in the state. And likewise, neonatal mortality and infant mortality rate, these are two indices which reflects the healthcare systems in the country as a whole. So it is neonatal mortality rate compared to the national data, Assam is in a better position, in the 20 per 1,000 live births, the national data, and the state data is 19 per 1,000 live births. So there are several causes. Already Madam has mentioned about the birth asphyxia, but again another common causes of neonatal mortality, like sir, mainly prematurity and low birth weight. So this is another prevalent cause, and some causes are sepsis because of the improper management of handling of the babies in the peripheries. And then prematurity, sepsis, these are leading causes, and other causes like birth injuries and congenital anomalies, that means defect at the time of birth. These are some major congenital anomalies which can lead to death of babies during the initial part of the life. So most of the babies, they die within the first 1 week, that is early neonatal, that is called first 7 days of life is called early neonatal period. The death percentage is highest during this period, and then neonatal period is called up to 28 days, first 28 days of life. Beyond that, it is called infancy up to 1 year of age. So in infancy, again the neonatal causes are the most common causes of death in infant mortality, which leads to infant mortality rate also. Like so, out of all infant up to 1 year of age, 40% death is in the neonatal period. So means it is one of the leading causes, and beyond neonatal period there are another causes like death due to diarrheal diseases, and which are preventable, and number two maybe death due to respiratory tract infections, that is another, that is pneumonia and other severe bacterial sepsis. And another causes is malnutrition in our country because of the improper feeding techniques and lack of promotion of breastfeeding. So that's why we promote breastfeeding exclusively up to first 6 months of life. So these are common, and injuries and other sepsis and other causes, meningitis, malaria, these are less common causes compared to developed countries in our country. So these are mostly the common causes of death in high neonatal mortality rate and infant mortality rate in our countries.
How would you like to increase the number of pediatricians in the current manpower crisis?
So there is means all the pediatricians mainly they are concentrated in the around the cities like Guwahati or other cities of the state. They are mainly concentrated around the cities. So we need to, and as a whole the number of pediatricians is less in our state. So we need to produce more manpower. So government of Assam from Shankardev University, there was a course for 2 years diploma, and those who were working in the peripheries like MBBS doctors, and they were given opportunities for doing the diploma in pediatrics for 2 years.
That is continuing still now?
No, that is, sir, now
discontinued,
not discontinued
due to different reasons.
Yes,
okay. So we can do that. I think again you can restart our doctors who are working in rural areas.
Yes, sir.
Take them in medical colleges and
can
give a sort of 2 years extensive training, and they go back. And when I was in Barpeta Medical College as principal, that course was running. And you believe me, some of these doctors who were given 2 years training in pediatrics, they did wonderfully well. And now, as my colleagues say, that they are still doing wonderful work. I think that course, if you can persuade the authorities to start that program, it will be helpful. Otherwise, as I'm said in my initial comments, that we cannot bring up number of MD seats in medical colleges. It takes lots of hassles. And 50% of the seats are going to the states outside Assam. So hardly if you increase 2 seats per year or 4 seats per year, 50% goes outside. So practically there is no benefit to the state.
Yes.
So that is one. And the training, skill training, as this came theme, what skill training are given?
So, sir, these are courses basically, diploma and PG courses, so which are given already. But there are other trainings which are given from government of NRHM, under NRHM, or in collaboration with, already Madam has mentioned about IAP, Indian Academy of Pediatrics, and National Neonatology Forum. So one of those.
Is it very costly, or it can be given
it
very
is
easily?
Not costly, sir. So this is called Navjat Sishu Suraksha Karyakram, one of those, so which was started in 2009, and all the doctors from peripheries, means mainly medical officers, ANMs, and they are given training under this on basic neonatal resuscitation protocol. So this is one-day program already under NRHM, and from the government side it is called NSSK training, and privately also, means from IAP, Indian Academy of Pediatrics, we are giving trainings to pediatricians and other sisters. So this is called Basic Neonatal Resuscitation Program. So another program that is called Advanced Neonatal Resuscitation Program, that is given to pediatricians, all pediatricians or anesthesiology obstetricians also they take. And then, sir, another one training is given to increase the strength of the peripheral workers, like FIMNCI, sir, program. So that is facility-based integrated management of neonatal and child health. So that is one of the training, and given to the peripheral doctors as well as ANMs and ASAs.
Two other points has come to my mind. One is that under 5 mortality is still high.
Yes, sir.
That she has touched to some extent. So you can say 1 or 2 words about that. And next is, please talk about anemia in adolescent girls, which is very important, because nowadays pediatrics departments, you are looking after girls or boys up to 18 years.
Yes, sir.
So please tell about the problem and the consequences.
So under 5 mortality, already I have mentioned that if the death of up to 1 year of age, that is infant mortality, is due to one of the causes is means undernutrition, which lead to stunting, that is decrease in growth in the terms of height, and wasting, that is in the terms of weight gain. So that is that will lead to poor health and ultimately leading to easy susceptibility to other infections, mainly bacterial infections. Diarrhea is very common, pneumonia is very common in those children who are undernourished. And ultimately, if they will grow up to adolescent age group, in adolescence, and if the girl is not healthy, then she will not become a healthy mother. So we'll have to take care of those adolescent girls, and so that they can become healthy mothers. So in adolescent, one of the problem is your anemia. That means nutritional anemia, sir. So that nutritional anemia, because of that, the mothers they develop spontaneous aberration. Also, most of the is seen in mothers who are mostly anemic, and the babies they grow very, they lead to small premature babies and low birth weight babies. Ultimately, the newborn which is delivered from those mothers, they will those babies will not be healthy babies. So ultimately, that will lead to increased neonatal mortality and infant mortality in the country. And so we need to take care of the mothers from the early adolescence. And anemia is one of the major causes of morbidity in those mothers. So under the governments, it is under the programs we give iron, folic acid supplementation, all those, and to girls, so that the anemia is taken care of.
How you teach your field workers to diagnose anemia in the field level, the peripheral level?
Actually, anemia is, that is called, we, in the field, we the term that as pallor. Pallor means paleness of the body. So anemia is diagnosed only after diagnosing the hemoglobin level of the blood. So in the periphery, we train the personnel by examining the palms of the, comparing with their palm. And that is one, nutritional anemia can be diagnosed. And second thing, we can give supplementation, prophylaxis iron therapy to those children, and deworming is one of the major mode of therapy. That means because of the poor sanitations in the periphery, so they develop worm infestations, and that will lead to more blood loss and in the blood, in the stool, and leading to again anemia and poor nutrition.
That is true,
yes,
but we have got a lot of hemoglobinopathies in Northeast,
yes, sir.
Where giving iron tablet may be harmful sometimes.
Yes.
So in the areas where your hemoglobinopathies are common, not very uncommon. I think detection of hemoglobin is also important.
Yes.
Because in them, in those ladies, young ladies, giving iron may be harmful.
Harmful, yes.
So that that aspect also you have to keep in mind. Now coming back, you know that we were little set, even 10 years back or 15 years back, we thought that there is very little role of radiologists in the management or bringing down the rates of maternal mortality, infant mortality especially. So we have a radiologist with us, and he will tell you what are the causes which can cause early fetal death or early infant death, and how they are diagnosed radiologically, and what is the lacunae. We don't have many radiologists, qualified radiologists. All just like pediatricians, they are all concentrated in cities, whether in government sector or in private sector. So how do you feel that this can be done? And if you don't have enough radiologists, whether these skills can be taught at least to save the neonates?
Good evening to everybody. Thank you, organizer, for calling me here for the panel discussion, Dr. Chakraborty sir. So first, how we can add something in reduction of the maternal mortality or fetal mortality rate or neonatal mortality rate. For that, we can go for ultrasonography, that is Doppler ultrasonography in pregnancy. In pregnancy, if we go for Doppler of, that is umbilical artery, that artery which goes from the fetus to placenta to carry the oxygenated blood back to that baby. So one is umbilical artery Doppler. Why it is? Because already our pediatrician already speak it out that most of the child mortality rate or fetal mortality rate or neonatal mortality rate is due to underweight or low weight or undernourished baby. So for that diagnosis of that underweight or low weight baby, we have to do umbilical fetal, that is ultimately we have to go through mothers, because ultimately it is a obstetrics radiology, that is ultrasonography. We will do for umbilical artery of the fetus. From that we can, if some abnormality is there, then we can go for treatment of the in that we can diagnose the undernourished person.
Now the question is that umbilical fetal Doppler study is not done routinely even in towns. So how do you propose that this can be brought to the periphery, or who are the persons you suggest to be trained?
No, there is another thing before telling this one. For anemia also, for already you have learned that due to anemia also there is death of the baby. For that anemia also, if we go for this Doppler study of the child, that is fetus, Doppler study of the medial cerebral artery, that is of the brain, we can understand about the condition of the baby, about anemia. So that way we can diagnose both the.
No, that is taken.
Then another thing. Then
Dr. Adhikari, that is taken.
Now I am going on. Now
Yes,
I'm going.
go to the point.
Yes.
Yes.
Now coming.
Yeah.
Now what happened actually? Now every radiologist is doing this Doppler radiography, that is Doppler ultrasonography. Every radiologist, all the radiologists are doing Doppler ultrasonography. And nowadays, previously it was not so. There may not be in Assam. I am telling in Assam. In my earlier days, I was only one radiologist in western part. Now, in Bongaigaon there are 4 radiologists. In Dhubri there is 4 radiologists. In Kokrajhar, every district we are having the radiologists. So from that point of
No, I
And
understand.
all are doing.
But do you think that hundreds and thousands of pregnancies can be covered by 4 radiologists in Bongaigaon and 4 in Dhubri? Is it enough? That's
Yes.
what. Is
Now
it enough?
another. Now
If you
another.
think there is enough, then it's okay. But if it is not enough, then how do you make people, they skill them, nurses or whatever, to do these tests?
Now another thing, we are not going to do this Doppler in every pregnancy, only which are risk pregnancy. In that cases, we usually do this Doppler. And about the skilling, see radiology, it is a, actually nowadays there is no diploma, only postgraduate in radiology. So it is a 3 years course. So after MBBS, we have to do 3 years radiology course. So there is in radiology, because it is a very complicated subject. So there is no provision of giving 6-month training, so 1 year training in general to the
I think there will be one exception.
And there
Dr.
is-
Adhikari, one exception is that our obstetricians are also taught how to do fetal radiography. And they are doing it, and they are doing it very nicely. All our
Yes, yes,
obstetricians, they are doing, so that gives a lots of help to the
Help to the-
radiologists.
yes.
But otherwise, you cannot do it. In medical college also, hundreds and thousands are coming to the OPD. So all our obstetricians, they are being taught, and they are doing it. I think that is
Yes,
going
they
on.
They are doing.
And
They're
they
regular
had-
doing.
and
regularly
I
doing.
think another point is that another type of training was given for the doctors from the periphery in medical colleges for this functioning of your radiology, especially in the pregnant mothers. But something happened, and you may be able to correct me that I think this is still in the court or something like that.
But ultimately, I think we have to go for this online or digital radiology, and it is already started. Now it is online, all the reports are online, then digital radiology is already coming. So we have to, that is, every doctor should be skilled in that digital method. I think my suggestion.
Okay. So I think you have given your suggestions and about scaling. There might be some other opinions. So we'll like to conclude this session. Just one point, everyone, all my panelists will give.
Thank you, sir. Actually, what Dr. Bipul and Rasna said, anemia is one of the indirect cause for maternal death. So we'll have to focus on anemia right from the teenage, right from the childhood, because our girls, if you say, they are always, we have got a custom that girls will eat last. The breakfast will skip. The girls and the mothers will take last, food last. That is our tradition. So that should be given up. So if we correct anemia, we can correct a lot of complications for the mother, for the babies, for the neonates also. So that is one of the most important thing. Secondly, I think for maternal mortality, one is hypertension. For that, regular checkup is required. Regular checkup of the mothers is very required. Now antenatal checkup is increasing to around 72% in our state. That is a good sign. Early admission, there is another, because we may encounter any complications at any moment. So these are some of the suggestions, and other causes are abortion causes. We have got training now on comprehensive abortion care technique for state doctors also. I think if we can stick into our programs properly, we can reduce the maternal mortality, we can reduce the infant mortality, even the neonates also. Thank you.
I think the most important thing, sir, is that in case of neonatal mortality or infant mortality or child mortality, or in fact even maternal mortality, we do not need rocket science. We just need to be aware that there are simple things which already are in place in our government setups as well as in the private sector. I will start first, I think, with the initiative which should be taken for the adolescent girl. Once we have healthy adolescent girls, then only they can become healthy mothers. But here you have to understand that they should get married at the right age. So I'm very happy that the government of Assam is being very strict on preventing child marriages. And I think there'll be deterioration, they will be deterred and they will not have early marriages. Because if the girl gets pregnant very early, then the problems compound. They have low birth weight babies, then they have premature deliveries, they have anemic babies because they themselves are anemic. And if we can first stop, we'll be at that point. And secondly, the referral system. I think we need to work on our referral system. Not all cases should come to the medical college. The peripheral ANMs are handling many of the problems very well. And the doctors in the PHCs and the CHCs should be trained with the simple techniques so that they can handle these cases. And the load on the medical colleges, that is the tertiary care centers, is decreased. I think that will be very good. And whenever they can detect that there is a problem, there's a problem of premature delivery or low birth weight delivery, this mothers should be transferred before delivery to the tertiary care center. Then only we can decrease the load on both sides. So that is my suggestion.
Thank you. So always prevention is better than cure. So Dr. Das.
Already Madam has mentioned about that teenage pregnancy should be avoided by postponing the marriage up to at least 21 to 22 years, which our government has, Assam government is promoting. So that will decrease the number of births. If the girl is married at 16, 17 years, the number of pregnancies will be more. So ultimately that will lead to more premature babies, and the spacing is less because they are not matured enough. And ultimately the spacing is also important. That means the gap between two babies, that is very important. And if we can postpone the marriage up to 21 to 22 years like that, so then the number of babies will be less and the mother will be matured, and delivery chances of having premature deliveries will be less. Again, sir, we'll have to promote the like contraceptive measures, and then already that facilities are there for referral transportation from peripheries to center, but because of the lack of knowledge of the people, they cannot avail those facilities. So we need to educate those parents, and the most important thing is sir, literacy. Female literacy is the most important thing. We need to promote those things. And after delivery of the babies, and we need to advise for full vaccination against the 7 at least vaccine preventable disease under the mission Indradhanush that is promoted by government of India. So we need to vaccinate all those babies for against this vaccine preventable disease. So these all will help in decreasing the mortality in babies and to improve the healthcare systems in our country. Thank you, sir.
My suggestion is prevention. So, already this pediatrician gynecology telling that it should be well nourished, or that is mother which is pregnant mother, they should be well nourished. And as the adolescents, if the adolescent is healthy, then mother will be healthy, then child will be healthy. My thing is prevention. So that will be better.
Thank you, all the panelists.
Thank you so much, sir.
Thank you so much, sir. Can I please call upon Ms. Radhika Rastogi, IAS Special Director, Lal Bahadur Shastri National Academy of Administration, Missouri, to please come onto the stage to give away the mementos to our panelists. Can I call upon Dr. Apurba Kumar Bhattacharya, Professor and HOD, ONG Department, Nalbari Medical College, Assam. And next, can I please call upon Dr. Rachna Das Hazarika, Senior Consultant, Pediatrics and Nanotechnology, Guwahati. Next, can I please call upon Dr. Bipul Kumar Das, Assistant Professor, Pediatrics, AIMS, Guwahati. Can I call upon H. Adhikari, MD, Zenith Diagnostics. And last but not the least, to wonderfully moderate the session, can I call upon Professor B.P. Chakravarti, Medical Director, Health City Hospital, Guwahati.